All right, welcome back to Pharmacist on Call. Your host, Dr. Shawn Pruitt, community pharmacist of the world, Craig. So welcome back to Pharmacist on Call, everyone. I did want to do another shout out right quick. I want to say a happy 2-year anniversary to my television wife, Linda, who is a viewer who has been watching the show for 2 years. And you may know her as the turmeric lady who always calls him the turmeric and the black pepper recipe. So Linda, we appreciate you supporting the show and the pharmacy. So happy 2-year anniversary between TV host and viewer. Want to get right back into your calls. It looks like we've got Mary. Mary, welcome to Pharmacist on Call. How may we help you?
No, not Mary, Barry.
Barry, okay, sorry about that. Welcome to Pharmacist. How may I help you?
That comment, it's followed by a question there.
Okay.
That woman that called in about cleaning her colon out.
Yes, sir.
She needs to. Hello?
Yes, sir. I can hear you. Go ahead.
She needs to go to the crystals.
Yeah, that is another way. That's probably the cheapest way to do
That's a joker. I got a serious question. I'm sorry. I got tickled there.
Yes, sir. Go ahead. What's your question?
Is it possible that marijuana is an aphrodisiac?
Yes, it is. It is possible because it works on the hormonal system.
Okay, because I don't want to sound funny enough when I say that, but we smoke it recreationally.
Okay. So absolutely, yes, it does play.
Just after we smoke it, we do our stuff there in the bed.
Mm-hmm. Yeah, I think that most people who recreationally smoke it would agree with you.
Do what now?
Most people who smoke it, I'm sure, would agree with you that it does have an aphrodisiac effect.
Well, I've always wondered if that was true. I know you being a pharmacist, you know more about it than I ever would, so I didn't know. Like I say, we smoke a joint there and go at it, and I mean, it's just...
Yeah, so just understanding how the cannabinoids work.
Like no other.
Yeah, it is entirely possible.
Okay, well, like I said, I've been just curious about that, and I appreciate you answering my question.
Yes, sir, no problem. Thank you for calling. All right. Thelma, welcome to Pharmacist on Call. How may we help you?
Hello, Dr. Pruitt. How are you this evening?
Pretty good. How are you?
Oh, pretty good. I have a question about the turmeric. But first, I wanted to remind you that Stephanie's birthday is in December also, so you might want to remember her.
Absolutely.
While you're doing birthday shout-outs.
Absolutely.
And I had a question about the turmeric. I wanted you to talk about some of the uses that it's for, and also, is the capsule as effective as the loose powder in the turmeric?
Good question. Good question. All right.
Thank you.
Yes, ma'am. All right, thank you. All right, so first, before that, yes, my late sister Stephanie, who passed away earlier this year in January, her birthday is December the 28th, so 29th, sorry. So certainly want to remember her. Sorry about that, Stephanie. All right, so getting into turmeric. Turmeric is an anti-inflammatory, so it has been shown to be effective for arthritis, and my patients who come to the pharmacy with even rheumatoid arthritis to the point where they couldn't even open their hands. After a few doses, their hands are opening up, they're able to walk a little longer, and even as Linda could attest to, that even bone on bone with your joints, with knees, that the anti-inflammatory effect is pretty serious. Now, it also has an effect as a mild blood thinner, so people who are at risk for having blood clots, turmeric daily can help reduce the instances of blood clots. It is also great for helping to heal the liver, and there's also studies that show that it's great for heart health, and probably because of the ability to reduce inflammation. And part of our issues with our heart are that we have inflammation issues going on inside of the muscle. And then there are also some studies that show that it has some anti-cancer effects as well. So turmeric is it's kind of like the beetroot juice. It is a superfood. Now, in terms of one being more effective than the other, inside the capsule is loose turmeric powder, but it is a more metered dose. And I prefer the capsules because you're not sure. Your dose of turmeric can vary from dose to dose if you're using a spoon, and you may put more on there. But at least with the capsules, you know that you're getting like 800 milligrams for instance, of our turmeric, you know in what dose it takes to effectively manage your pain or whatever you're using it for. Okay, so looks like, well, you guys, your phones are lighting up again. All right, so we're back to line one. Danny, welcome to Pharmacist on Call. How may we help you?
Can you hear me, Dr. Pruitt?
I can hear you.
Hey, brother, back to the marijuana subject.
Yes, sir.
Okay. Now, people going to pain clinics in Tennessee have to sign a contract saying that if they test positive, for marijuana while they're on opioids, that they get kicked out.
Okay.
But does the oils, will it have the THC in it? Hemp oil, that's right.
Hemp oil, no, sir, you will not test positive because the percents of THC are very low. So less than 0.3% is what Tennessee says is legal.
Okay.
That's a very minute amount.
Once they legalize it, we'll have to go through that next summer. Who will dispense it? Like your pharmacy, or regular pharmacies, or special pharmacists?
Now, I think that is what is going to be talked about, as they come up with the legislation for what is coming.
Okay.
But I'm going to get into what you talk about in depth once we get through all of your calls here.
Okay.
But you raise a very good point.
The reason I'm asking, I got an old friend, I hadn't seen him in years, and he was on a lot of morphine and a lot of Roxy. Cotton, I think it is.
Yes, sir.
So he started the hemp oil, and he's smoking too.
Okay.
The THC. Dr. Pruitt, that man is cleared. He's in no pain, he says, and I can understand him now. They had him so, drugged up.
Absolutely.
I'm getting there. I'm on 120 milligrams of morphine and, 80 milligrams of Oxycontin and 800 milligrams of gabapentin. But I'm hoping this marijuana comes around that it can help those people in chronic pain, Dr. Pruitt.
It is coming, Denny. It is coming.
Okay. And that cleared his head, so I figured I need to get my head cleared too.
Absolutely.
All right. God bless you and have a Merry Christmas.
Yes,
and
sir.
I'll
You too.
hang up and let somebody else talk to you.
Okay. All right.
Thank you.
Ken, welcome to Pharmacist on Call. How may we help you? Hello, Ken.
Yeah.
How may we help you, sir?
Hey, I've been taking painkillers for almost 30 years now, and with all the problems they're having with it right now, one of my pain specialists I went to see is retiring because she's tired of having to deal with the government and all the restrictions they're putting on it.
Correct.
Is there a lot of that going on right now? Because I've had to go to another pain clinic because of this, and it's just, I've been taking it for a long time, and it allows me to work.
Yeah, and to answer your question shortly, yes, there is a lot of pressure on prescribers from the feds because we're in an opiate crisis. And unfortunately, Tennessee is one of the top states where the problem is. And so physicians are having to now change the way they prescribe, or being pressured to change the way they prescribe. So it's sort of like the feds dictating the way that you prescribe medications, but it is in hopes that we can diminish some of the opioid crisis. And even at the pharmacy level, we face increased scrutiny and oversight as well. So there are certain things that we have to do to make sure that we are following the new pain guidelines, and of course staying out of the crosshairs and staying compliant with what,
I agree with that. There is a problem, but
Yeah.
it's something. I'm 61 right now, and I'm getting fairly close to retirement, and it's once I quit working, my need for them will decrease quite a bit. But it's getting to the point where I might have to retire early because I can't get the relief I'm going to need to be able to continue working.
Well, there are still people who are still practicing. You're just going to have to find one of them. Yeah, but some doctors, they are tired of the issue. And I have seen some close up shop because of the pressure, and sometimes they're forced to close. They don't have a choice.
Right. Well, I go to legitimate pain clinics. I'm not going to some pill doctor, I go to a clinic that I've been going to for years, and they're just tired of it now.
Yeah.
So I think it's quite unfair of what the federal government's doing to people that legitimately have a need for this product, and they're putting us right out of being able to live somewhat. I mean, it doesn't get rid of all my pain, but it takes the edge off it where I can function.
Yeah, unfortunately, the minority of people who are doing the wrong thing are affecting the majority of the people doing the right thing, and it's probably people getting it through illegal channels, not even actual patients. So, yeah, but I agree with you wholeheartedly.
You don't think is there a light at the end of the tunnel here, or do you think it's going to be an ongoing thing for years to come now?
In terms of the scrutiny,
yeah.
I think it's going to be an ongoing thing until we reduce the amount of opioid deaths, or if something, is done with the types of opioid drugs, if something is done to where they're not so easy to get.
I wish they would have got a hold of this before it got to the point it got to. That's the only thing that really upsets me. All right, sir, you have a good evening.
All right, yes, sir, you too.
Thank you. God bless. Merry Christmas.
All right, you too, sir. All right, everyone, stay right there. The phones are lighting up. We'll be right back.